Hi everyone. I'm going to talk about Bon Secours Health System, and I'm going to give you a brief history about Bon Secours Health System. The Sisters of Bon Secours were founded in 1824 to help the sick and dying, and in 1881 they arrived in Baltimore, Maryland, and they established their first hospital there. And since then, Bon Secours Health System has grown. And in Virginia too, we have 6 hospitals in Virginia, and out of the 6, I have chosen to talk about Maryview Medical Hospital in Portsmouth. Our mission, Bon Secours mission, is to bring compassion to healthcare and to be good help to those in need, especially those who are poor and dying. As a system of caregivers, we commit ourselves to bring people and communities to health and wholeness as part of the healing ministry of Jesus Christ and the Catholic Church. Maryview Hospital has 466 beds, and services available at Maryview Hospital include invasive surgery center, heart and vascular center, we have surgical weight center, we have neuroscience institute, we have orthopedic institute, we have behavioral center, we also have advanced image and radiology department, we also have colorectal cancer care, we also have Maryview Center of Physical and Rehabilitation. Maryview Hospital in Portsmouth do utilize the professional practice model, and the professional practice model in Maryview is rooted in Jean Watson theory, and the first one is to instill faith and hope, nurture individual spiritual beliefs and practices, develop help trusting relationship, promote and accept the expression of negative and positive feelings, use creative problem solving methods for decision making, perform teaching that addresses individual needs and learning style, creating a healing environment for the physical and spiritual self which respect human dignity, assist with physical, emotional, and spiritual human needs, also allow room for miracles to happen. And Maryview Hospital nurses do clearly follow the professional practice model PPM, and it is clearly written, and nurses do apply Jean Watson theory during their shifts, and this is seen through problem solving using the evidence-based research to promote effective care. Nurses have utilized, they make sure that they are following a preventive measure for falls. We call them fall bundles in Maryview, and also nurses are advocating for earlier removal of catheters to prevent CAUTIs, illnesses, and or diseases. And we can say that nurses do give holistic care and competent care while following evidence-based research and following nursing research. Also, the PPM model is being utilized when we come to patient and family members, and this one is done through the teaching and assessing and making sure that we are educating our patient, and the teaching and during the change of shift we involve the patient, and the patient can tell us what is happening, and if we miss something during the change of shift, we also rectify, and this help improve care, since we might think that we know the patient, but the patient know more about his or her illness more than we know. So when we're doing our change of shift and we're doing the report, we will learn a lot through involving the patient and the family members. For example, maybe we may think that the blood pressure range is okay, but then the patient will tell us, no, I think that my blood pressure is always on this range, or my sugar levels are always on this level, and that we can be able to help the patient meet the desired outcome and goals that we want the patient to meet. We can also say that the PPM model is providing the spiritual help to those who need them. For example, maybe we might have patients who are dying in hospice care. We have patients who have been diagnosed with chronic illnesses or terminal illnesses, and nurses like cancer and nurses and doctors, may request if a patient needs to see a chaplain, so that can help with the coping mechanism. And also we can say that Maryville Hospital is we can say it do really follow the PPM model, and this has improved the care that we are giving to our patient. We cannot deny it. As nurses in Maryville, the PPM is being utilized, and the care is being improved day by day. Thank you so much.